keeping your practice secure in a digital age. So really, there's two questions I get asked a lot. One is what is compliance and what is security, and how are they different? And so compliance is really the act of documenting, or I should say it's auditing, documenting, and assessing the current state of in this case, computer system or a company's computer systems, and applying that against a security framework like HIPAA. And so it's very much the paperwork side, it's the process side, it's the documentation side of this conversation. Security is the actual act of putting in place something that will protect you or your business or your information from an attack. And so they're very, very different, and I'll go into both of those. So Jenny, would you mind running the first survey, which is going to be for compliance? And this survey, if everyone can, say yes or no, what I'm looking for is I'm collecting data across my presentations for those who, if you, your clinic, or someone you know personally has actually been audited by Health and Human Services. And so if you have, just answer yes, and if you haven't, answer no. And I'm going to keep moving through this as those results come in. So why are we talking about this subject to start out with? So really, it's all about protected information. And why should you care about that information as a clinician or as a business owner? So it's electronic protected healthcare information. And these are things like your first and last name, social security number, date of birth, diagnosis code, your medical history, things that your patients want to be private and could potentially be hazardous if it was publicly accessible. And so many years ago, the United States government put into law the basically HIPAA, which is the Health Insurance Portability and Accountability Act. It was placed into law in 1996. And this law was designed to protect patient information as patient information began to flow through electronic systems, through computer systems. And they realized it could be intercepted or it could be captured and used inappropriately. So it is law. I have at the bottom the reference for that with that QR code. So who's covered by this? So we're going to go over those who are covered entities. We're going to talk about business associates, and those are the people that have access to electronic patient information through a covered entity, so like a subcontractor, and basically talk more about what's protected, the electronic protected health information. So who's a covered entity? And this is a really important point to point out. So you have health plans like insurance companies, Medicare, Medicaid, HMOs, PPOs, and et cetera. Any large organization that provides insurance and as part of that process needs access to patient information. Clearinghouses. So these are organizations that process EPHI. They may be between an insurance carrier or a laboratory, but they're ultimately getting their hands on EPHI. And then providers. So this is where I have questions frequently of practitioners I work with say, hey, but I'm not really covered by this. And so the rules of the HIPAA security agreement basically states that if you're a doctor, your clinic, the business itself, if you're a dentist, chiropractor, a nursing home, pharmacy, etc., you have access to protected health information, and you're a covered entity. And so, I asked the question, are you covered? And if you fit into any of those, then you certainly are. I had a customer once let me know that they felt that they weren't covered because they didn't take insurance. And so although the name, the HIPAA security guidelines have insurance in the name, if you're a physician and you have electronic patient information, you are a covered entity. So business associates, this is one I get a lot of questions about right now.